Hey everybody, I'm Mike Krupa, and today we are going to talk about how to strategically plan if you're an employer and you have a self-funded health insurance plan. Because what I have observed as I have been talking to many self-funded prospective employers is that there's not a lot of long-term planning going on. And that is largely driven by the broker. But because there's no long term planning, it's creating some pain within the health insurance plan. And that pain is kind of twofold that I see. Self funded employers were promised all these savings, and yet the self funded plan isn't performing as they expected. And then, two, they're not getting any new ideas to control costs right now. Establishing control within your health insurance plan, obviously one of the critical steps in the remodel benefits process. While self-funding gives you the ultimate control of your health plan, you still need to long-term plan. You still need to look at your data. Those are the other things that you can do to establish control within your health plan. So what I thought I'd do today, instead of telling you exactly how to strategically plan, because every employer is different, I thought I'd walk through an actual client strategy presentation that I just did for an employer. Now, keep in mind, 1/1 of 2025 was their open enrollment. We had kind of wrapped open enrollment up. This was our first quarter meeting last month to talk about planning already for January 1st of 2026. So I'm going to walk through this example so you can see what you should expect from your broker partner. So here's a quick agenda. Basically, I'm always looking for an update from the client on their business. I want to understand what's going on. Always like to recap what we did from the prior year after the dust has settled, to highlight everything that we collectively accomplished and to maybe look at some things that we still got to work on. Talks about lessons learned from the employer side, from the broker side, from the carrier side, just like what can we all do better? Data observations, pretty key. And then we start immediately getting into strategy. What's your marketing strategy? What kind of opportunities do you want to look at for the upcoming year? And then in this particular case, we had been talking to this client about potentially implementing direct primary care, which is a concept to control health insurance costs. And so we did a deeper dive on this specific topic. And then we just wrapped up with timeline and next steps. What do we have left to do? But the business update, so simple, right? We just want to understand what's going on within the business and what kind of operational priorities you have for the year we're in right now, because that can dictate, how much bandwidth you might have to make some changes. With this particular client, they had let us know that they had just implemented a new practice management software company-wide, and that was going to be taking up a ton of mental bandwidth from people. So this is probably not the year to make significant changes to the health insurance plan. We learned a little bit more about their business as well, just kind of helps set the stage. And then quickly get into, hey, what did we accomplish last year? We did a ton for this employer within the first year. They were a new client last year. And so we had marketed everything. We had looked at alternate carriers. We had looked at alternate networks, a lot of different things. We looked at the ancillary as well. So the life, the disability, dental, vision, all those different lines of coverage. And we did a lot. We achieved a lot of savings, achieved a lot of very good things. And we'd also ran a what's called a compliance assessment for this particular client last year. And so we're bringing up some issues we had identified during that plan assessment in this meeting as well. And then lessons learned, this is really an opportunity for you, the employer, to tell us, the broker, what did we do well? What could we improve for the next year? That could be the broker. That could be your team internally. That could be the different carrier partners. Let's understand what worked well, what didn't, because we can't get any better if we're not constantly learning about how we could get better. So that's pretty key here. And then we dig right into data. So You'll see this is just one page on this particular client's data, but we had ahead of time done an annual review with the insurance carrier on both the medical and the prescription drugs. And then we kind of dug into the data separately and put in the highest level observations, because what this is really supposed to do is to start to guide our strategy going forward. We want to understand how the plan is performing. We want to understand how costs are compared year over year. And we want to understand what are the top things that are driving our health insurance costs right now, because that's what we should focus on for our potential strategic opportunities in the future. And so we go through that, and then we dig right into our marketing strategy. We want to know well ahead of time what we're going to be doing in terms of workflow, because it just allows us to plan. And so we talked about every single line of coverage, whether we plan on marketing that line of coverage or not. And in this meeting, we all have now a plan going forward, us, the broker, and the client, of how and who we are going to market to for 2026, right? And then we got into strategic opportunities. So on here, there's 5 different potential opportunities that this employer was looking at. This is really meant to kind of spur some discussion on what else that they wanted to do within their health insurance plan. For this particular employer, we're going to focus on closing the RX formulary this year. That's one of the main things that we want to look at and educate their members on Medicare, because this employer, like many, has a lot of folks that are eligible for Medicare and are still enrolled in the self-funded health insurance plan. And so can we educate them and have them potentially take Medicare if it's a better option? That would be a win-win for everybody. So just some things that we focused on. Every employer is different when it comes to strategic opportunities, because we got to let the data drive our decision-making process. Finally, we just revisited our multi-year strategic plan. So, the previous year was our first year as the broker for this employer. So we drafted a 3-year plan. We started executing on that. And then we made some changes. So we refreshed our year 1, and then you got to go into year 2 and year 3. What are we going to do now? Right? And that's where we identified, we're going to look at some prescription drug formulary options for these, for this employer. We're going to potentially pilot direct primary care, but all things to try to move us along the spectrum of strategically planning. And then lastly, this particular employer has expressed an interest in this concept called direct primary care. And so what we did during this meeting, we did a deep dive into what is direct primary care, how would it impact your health insurance plan, with the ultimate goal of trying to understand, is this something that you want to pursue for 1/1/2026? Ultimately, where we landed is, hey, we kind of like what we're hearing, but we got to get this in front of the board. So during your next meeting that you'll come out in Q2, can we stick around and can you talk to the board about this concept of direct primary care? And that's what we'll do when we head back out there in June, is we'll do a deeper dive into this. Again, trying to get everybody's buy-in on what are we doing from a long-term planning perspective. That is how you will eventually get to a point where you can manage your health insurance costs. And then we just wrapped it up with timeline and next steps. We'll probably be going out there, it says August here, but I think we'll be out there in June or July to talk about a pre-renewal and just what are the financials looking like for 1/1/26 if we had to project what the renewal would look like now. And then put some numbers around the strategic opportunities we're discussing and potentially pursuing. With finally just getting down to open enrollment, right? We're always looking towards open enrollment and trying to plan for a successful open enrollment.